Hey guys, welcome back to another vlog. Today I'm going to be taking you guys with me along my journey with my LASIK eye surgery. So I'm on my way right now to the location. I'm actually getting my eyes done today with Dr. Tooma, and he is located in Newport Beach. I've been wanting to get LASIK done for about a year already, to be honest. Like, I was always so scared. If you guys hear like fingers being sucked in the back, it's Emmanuel. He's having what did you get? An egg McMuffin. Yeah, he's back there, you guys. So he's going with me today. I begged him to leave the office to like come with me because I'm honestly scared. And I went to a consultation with them, and their office is beautiful, by the way. Like, the employees are really nice, and they are able to explain to you like the whole process and stuff like that. Because since LASIK is still fairly new, like, I don't really know anybody who's ever gotten LASIK done besides my tia, but she didn't go with Dr. Tooma. And I've heard that Dr. Tooma is like one of the best, so I'm giving him a shot. You guys know I'm addicted to getting shit done, you know. It's because last time I uploaded my getting my veneers done, a lot of people were talking shit about me, like, oh my god, you get so much shit done. And I'm just like, okay, well then don't get it done, like, period. That's all you gotta do. But me, I'm gonna continue to get shit done until the day that I die, because I don't want wrinkles, I don't want none of that. So we all have different lifestyles, we all have different things that we like to do. I'll have the guy there who has like given me my consultation give you guys like more full details on the procedure. But yeah, it's really simple. There's no downtime. All you have to do is sleep. I know you also do have to like wear glasses like out in the sunlight or whatever, something like that. I'll give you guys more details, but I gotta finish my breakfast because we're gonna get there in like 20 minutes. Oh my god, so I just got done with my paperwork, and then they're gonna give me my Xanax, and then I have to wait for the Xanax to kick in, and then they'll be able to do my eyes. But he said it only takes like 7 minutes. That I'll be here in total for like 45 minutes. So right after I get it done, like, I'm not gonna be able to see, right? Or it's gonna be blurry?
It's gonna be a little blurry, but
okay.
Yeah, you'll
so
still
like,
be able
don't
to
freak out.
Right when you sit up, you'll be able to see something. Yeah.
Oh, okay.
All right, so let's put on your tracking device.
Cool.
So you can't run out of here.
Thank you.
You're welcome. That's right?
Yeah, it is.
Okay. Memorize. All right, let's go back here. Let's do some quick and easy testing first. We're gonna go to the pre-op section, so we can calm your nerves. In here. Anywhere you want to sit.
The relaxing areas.
See, we got the
Is this for like the
ocean.
husband and like the patient?
Whoever. Yeah.
Let's put him over here because you guys have, let's put her on the end over here.
Sure.
Yeah, right over here. That way I can get another chair. And there's just more space here.
You got it.
And I have a 0.5 Xanax to give you. It's just enough to relax you, take the nervous edge off. It's not going to put you out. We're going to give you more afterwards though that will, okay? Okay, so you can take this for me. I'll be right back to get another chair. Yeah, just put on my lower. Yeah, please. Thanks.
Take it. If you don't want it, you can give it to me.
I'll just take it. Imagine I just like turn around and I throw the pill in the back.
It's just, you know, it's calming your nerves, and then it's going to be later just to put you to sleep. Yeah. Sleeping helps the healing.
Some drops in your eyes. Oh, there's an extra seat if you guys need it. Drops in your eyes, an antibiotic, an antihistamine, an anti-inflammatory.
I hope that I took all the drops correctly. I just kept putting them on.
You did?
Yeah, I was
Good
just
for
like,
you. Okay. Afterwards is what's important, not so much before. Okay.
oh, okay.
Chin all the way up for me. Put the antibiotic first. Look all the way up, sweetie. That's good. The numbing drops will be administered right when you go in the procedure room, okay? Lightly close your eyes. All right, next one is an antihistamine with the decongestant. It's just going to eliminate redness, okay? Nice white scleras. Look all the way up. All the way up. Perfect. And lightly close your eyes. This last one I'm going to put in is a non-steroid anti-inflammatory, much like an aspirin for the eye. And again, the numbing drops will be right before you go in there, okay? All the way up. This one I save for last because it may have a little bite. It's not real pH factor friendly. Some patients it really bothers and others it doesn't, so I always put it in last. I think you're doing okay. Here's a Kleenex for you, Jen.
Thank you.
You're welcome. All right, blue bonnet time. Excuse me. Pros and cons to everything. You get the Xanax, you also get the blue bonnet. Just tuck all your hair in there for me. I'll take that cup from you.
Thank you.
You're welcome. Very good.
Yeah.
All right, let's get your kit out. Okay, same drops you had prior to surgery. You're going to start back up tomorrow. Okay, you don't need to do any drops today. We're doing them all for you. Okay, so I've got a brand new drop schedule for you. I'm going to say 3 drops tomorrow, 4 times a day, breakfast, lunch, dinner, bedtime for 7 days. I'm going to put an iPad on that's going to go over all this in great detail, so I'm just kind of summarizing it for you, okay? Aspirin,
You guys, I just took the Xanax and I'm like waiting for it to kick in because I'm like curious to see how it feels. Right now I am watching this little video that they have me watching, and then they're gonna take me in. And they said that they're gonna be like showing on a big screen my actual eyeball and like the cutting of it. Jesus Christ.
They're numbing her eyes right now, and then Dr. Tooma's gonna just tell her what she's gonna, what to expect. You think she would want the bear? I can tell him to ask me.
So what's the...
That's tape. Taping back her eyelashes. So that's for tracking, extra tracking. Yeah. Because this laser has an eye tracker. So that goes away. Yeah. Those are lid speculums. That's what's going to hold the eye wide open. Her eye's completely numb at this point, so she doesn't even feel anything. She doesn't even know if she needs to blink, if it's dry or what. This laser is the one that creates the flap. This is what Dr. Tooma was instrumental in getting FDA approved almost 30 years ago. So it's going to create suction, and it's using gas bubbles to create the flap. In most places they use older technology, different types of gas bubbles, so the cut is like uneven, or some places will still use a blade. Yeah, so yeah, we're all laser LASIK, only lasers. So those are gas bubbles that separate her cornea, which is essentially her flap now. So you'll see Dr. Tooma take a dull instrument to lift it.
So that's part of her eye that's coming out?
That's her cornea, part of her cornea. That's why we need like thick corneas. So he's lifting it. And then now the laser, the German engineered laser that has an eye tracker is going to reshape the cornea. This is basically removing her prescription. At this point, ask her what she smelled.
Smelled?
Yeah. It's a cold laser, but some patients say that it smelled like it was something burning or something, but it's really just the gas. And that's it. That's her. That was LASIK for one eye.
Wow. That's insane. So that's it?
Yeah, that's it.
Wow.
Yeah. So we're gonna do the next eyes. Right now he's just smoothing out the flap, making sure there's no air bubbles and there's no gas bubbles in there, no extra cornea. And more numbing drops. And one eye is done. Oh, she lost an eyelash. Oh, just kidding. She was gonna get mad at me. I'm sorry. But we do tell patients you may lose 1 or 2 eyelashes. All right, so more numbing drops. So we're very generous with them, so you don't feel anything. Then we're gonna tape back the eyelashes so they're not in the way of the laser. And then lid speculums that hold the eyes wide open. He's telling her what to look at. Usually it's like red lights, green lights. Alright. So the first laser is a Zemer Swiss engineered laser that creates the flap by inserting gas bubbles into the cornea at about 100 microns. Ask her what she sees here too when it creates the suction. Some patients say that it goes black, you know, some say they see bright light. So it's inserting the gas bubbles. It's all done by a laser. It's creating the flap, so it's perforating the edge, so Dr. Tooma can lift it. There it goes. You can see some of the gas bubbles in there still. And they just evaporate. And he takes a dull instrument. It's the gnarliest part, it's just lifting it. And he keeps it still, you know, hinged at the top there like a book. Like the cover of a book. So you'll hear the laser, he's lining it up, centering it. He even holds it a little bit for more stability. But it has an eye tracker, it moves faster than the eye can move. So it would stop if she accidentally looked away or something. So she's just staring probably at like that red light right there. And she probably just sees like strobing. And that's it. So now he's gonna lay the flap back down and it sits in there like a manhole cover so it doesn't move anywhere. So that's why she can automatically blink right after.
So that flap, that's part of her normal eye.
Yeah.
That's
yeah.
insane.
That's why we need thick corneas, so we did those tests to make sure we can do it safely.
That's insane.
Yeah. And then those nerves are just gonna fuse back together, and that's it. Like I said, it's just smoothing it out, making sure that it's all flat, there's no air bubbles, gas bubbles. He's checking it one more time. And then removes everything.
All done?
All done. There you go. When I did mine last year, I got it too quick and I hit my head. These are my coworkers and my friends, they didn't tell me. She's probably gonna cry. So easy. And then we're gonna go this way. Keep it on.
Did you guys see my eyeballs?
Yes.
Yeah? Did it look crazy? Yeah?
Did you want to say
It
anything?
smelled like, okay, yeah, you can say it.
She was awesome. You were awesome. She
Thank
was
you
a
so much.
great patient.
It felt crazy, but it was so fast. I mean, I always get stuff done, so like I feel like that's why I was able to be calm.
Yeah.
Yeah.
No, you did beautifully. You'll be 20/20 or better.
Yeah, and I
hopefully
can see,
tomorrow.
I mean, it did go dark, but it was just because of the pressure, right?
Yeah.
Yeah.
Well, it covers the eye, so that's why.
Right, it didn't feel like, oh my god, I can't see. It just felt like, oh, there's pressure.
Right.
You know when you close your eye and you just
Right.
like put pressure on it? That's how I felt.
But it was quick.
Yeah, no, it was super quick, like crazy. I can't wait to see the footage. I want to see what it looks like.
It looks crazy.
Yeah?
Yes.
But I can see, like I
pretty
can
gnarly.
see.
That's
Like
awesome.
it's just, I mean, a little bit blurry, but I mean.
That's normal.
And it progresses, right? Like tomorrow?
Yeah, tomorrow will be
Over
20/20.
time?
Will be perfect.
No way, tomorrow?
Yeah.
I feel like I'm gonna cry when I'm gonna be able to see, because I almost crashed the other day.
Really.
Yeah, I almost crashed because I forgot my glasses.
Oh.
I'll be able to be a safe driver.
Are you sure?
Great.
Thank you so much. Thank you.
What I need. This one's the 0.5 milligram Xanax that you're gonna take there.
Yay, more drugs.
Yep. Just make sure you're blinking your eyes for me there. Your eyes are numb, so you don't have the sensation to blink. So it's important that you're forcing yourself to, okay?
I'll have to like force it?
Yeah.
Like even if I don't want to?
Mm-hmm.
Okay.
Yeah. Because you can literally have your eyes open for like 10 minutes straight right now without you knowing it, but I don't want your eyes to dry out, so that's why I want you to keep blinking. Okay?
That's because it's numb?
Correct.
Okay.
Yeah. So you're gonna keep blinking until you get out to your car there. Keep them closed the entire way home, please. As soon as you get home, I want you to switch over to the goggles and take the Xanax and walk out, okay?
Make sure the goggles aren't too tight.
Okay.
So that'll knock, that's a Xanax bar.
She wears
that
that
you
to
basically-
sleep.
Just to sleep
I
tonight.
should knock you out for
Or
12
today.
hours. Okay, first side. No phones, TV, computer, any of that today, okay? I don't want your font to get wrinkled or dislodged, okay? So sleep today. By the time you wake up tomorrow, you should be perfect 20/20 or better. And everything will be crystal clear, okay? It's like looking through fog right now, right? Pretty decent?
I mean,
It's gonna be even better tomorrow.
Okay.
Okay? But just keep your eyes closed for the duration of today.
Okay. I'll keep my eyes closed throughout.
Blink while walking, close in the car.
Okay.
Okay?
Why in the car? So I don't
Just,
follow stuff?
yeah, bright lights and stuff.
Oh,
We don't
okay.
want it to dry out either. Cool?
Okay, cool.
All right,
Thank you so much.
congratulations.
Thank
All
you.
right.
We'll text you. If
Yes, send everybody.
Thank you.
Okay, so I literally just got out. I can't believe how easy that was. I mean, during actually getting it done, it was like crazy, feel me? I mean, during actually getting it done, it was pretty crazy, but it's nothing that lasts longer than you can handle. Like, I'm tripping out how, what the fuck, that was so easy. So the time that I'm gonna be, so now that I'm gonna be getting in my car, I can't open my eyes. Like, I have to keep them closed. But I feel perfectly fine. What the fuck? This is weird. And the Xanax didn't even hit. Oh my god, my name tag flew off. I wanted to give you guys an update on my Lasik eye surgery that I got a few months ago. I had totally forgot to do like an ending, kind of like give you guys my full-on thoughts and also talk a little bit about how my recovery went. Overall, I guess I could say that getting my Lasik eye surgery done was one of the easiest procedures that I have ever gotten done in my entire life. Just because there's not any downtime. I literally went to sleep and then the next day I ended up going to Louis' party. I did mention in the vlog, I was like, fuck, I really hope that I'm able to go to Louis' party. Bitch, I ended up going to his party. I was perfectly fine. I had zero pain at all, so I didn't even have to continuously take Tylenol or anything like that. The only thing that I will say that I did experience was dryness of the eyes, which is a normal side effect, and they did mention that my eyes were going to be dry. So my doctor, after I got the procedure done, I want to say it was like a week, then I went to go see my actual eye doctor because they got to check your vision and make sure everything is good. And I told her like that I had really dry sensitive eyes, so she prescribed me 2 separate types of eye drops. Let me show them to you because I still use them till this day. The dryness stopped, I would say, after a week to 2 weeks, just depending. I want to say that everybody's experience is going to be different, but dry eyes was something that I did get a lot of symptoms of. So she recommended these lubricant eye gel drops, and then she also prescribed these. Now they will give you like eye drops right after you get out of surgery and things like that, so you're able to use them. But this was like after I've already finished all the eye drop. Like I said, it's been a few months already. The only time that I do experience dry eyes is like when I've been watching movies all day. I've noticed that like after I watched like 3 movies or I'm just watching TV for multiple hours is the only time that I experience dryness. And also my doctor did tell me that you can get up to 2 procedures done. So when you're like signing the contracts and everything like that, if you actually book an appointment with NVISION, you are able to get a second surgery if just in case your eyes aren't at 20/20. Also, I will say that your eyesight progresses over time, so you are able to see clear the same day and the next day gets better. And it's so crazy because I feel like the craziest thing about getting LASIK eye surgery was that the second day I was like, I feel like I'm not really seeing super duper duper clear. And then I put on my old prescription glasses, the clear ones that I would always wear, and that prescription was no longer for me because it was super blurry, and it was just so insane to see through my old glasses that I would normally like depend on to be able to see, and it's no longer my prescription. So I no longer have astigmatism either. When you get LASIK surgery and you have astigmatism, it goes away because they pretty much burn off like the top layer, so it like makes your eye normal again. So that's really, really cool. Other than that, I feel like it has been a life-changing experience, and if you are thinking about getting LASIK eye surgery, I 110% recommend it. After I got it done, I was like, wow, that wasn't bad at all. That was one of the easiest procedures. Like, I wouldn't even consider it a surgery because of how simple it was. Like, I've gotten injections done on my face, I get my lips done all the time. I mean, I've gotten my boobs done and things like that. So I do know what it's like to go through like a really scarier surgery where I'm taking narcotics like every hour and shit like that. So yeah, so that was my experience. I would totally recommend for you guys to go with Dr. Tooma. He's a really, really good doctor. If you guys are looking into getting your eyes done, I would totally recommend to go there because the service is amazing. The place is really, really clean. They know what they're doing, and y'all know. So yeah, that pretty much completes the video. If you have any other questions, go ahead. Please make sure to link them down below. If you have gotten LASIK eye surgery, how was your experience? Because maybe other people's experience is different. If you guys do decide to check out NVISION, I will go ahead and link the website down below so you guys are able to book your appointment. You can book a consultation. I booked a consultation before, and they pretty much kind of go over everything, what exactly they do on the eye, and post-op, pre-op, all of that good stuff, antibiotics, all of that good stuff. So yeah, that completes today's video, you guys. I'm gonna go to sleep already. I'm gonna go make some spicy noodles. Probably I'm gonna stay up watching mukbangs. You guys know I love to watch mukbangs. Like, that's my shit. That's my shit. All right, you guys, I'll see you all in my next video. Bye.